Hello everyone. Today, we're diving into the world of a medication called glycerin, commonly known by its brand names such as Glycerin Suppositories and Sani-Supp. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Glycerin, known by its brand names Glycerin Suppositories and Sani-Supp, is a hyperosmotic laxative. Its primary function is to relieve occasional constipation by drawing water into the intestines, which helps to soften stools and stimulate bowel movements. Glycerin is commonly used as a rectal suppository and is available over the counter without a prescription. It is suitable for adults and children but should be used according to the instructions provided by a healthcare professional or the product's packaging. Warnings: While glycerin is generally safe for most people, certain precautions should be observed. It is not intended for individuals with rectal bleeding, intestinal blockage, or symptoms of appendicitis. If you have a sudden change in bowel habits that lasts for more than 2 weeks, you should consult a doctor before using glycerin. Prolonged or excessive use can lead to dependency or worsen constipation. Before taking this medicine. Before starting glycerin, it's essential to consider several factors. Inform your healthcare provider if you're allergic to glycerin or any other ingredients in the product. Those with conditions such as heart disease, kidney disease, or electrolyte imbalances should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider before use. You should not use glycerin suppositories if you have an allergy to it or any severe abdominal conditions, including bowel obstruction, gastrointestinal bleeding, or if you've had recent surgery involving the rectal area. Side effects: All medications can have side effects, and glycerin is no exception. Some individuals might experience rectal discomfort, burning, or mild cramping. These side effects are usually temporary and should subside after the bowel movement. However, if you experience severe discomfort, rectal bleeding, or if the suppository causes no bowel movement after use, you should seek medical attention immediately. More serious side effects are rare but can include symptoms of an allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing. If you notice any of these symptoms, stop using the product and seek medical help right away. Interactions: Glycerin might interact with other medications. It's important to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when using glycerin. For adults and children over the age of 6, the usual dose is 1 suppository inserted into the rectum as needed. For children under the age of 6, it's essential to follow the guidance of a healthcare professional. Always follow the instructions on the product packaging or those provided by your doctor. Do not use more than the recommended dose, and avoid prolonged use to prevent dependency or adverse effects. Avoid: While using glycerin, it's advisable to stay hydrated to help ease bowel movements. Avoid using other laxatives unless directed by your healthcare provider. If you experience persistent constipation, seek medical advice rather than increasing the dose or frequency of use. FAQ: Many wonder about the age restrictions for glycerin. It's generally considered safe for use in children, but it's always best to consult with a healthcare provider for any specific queries related to this medication, especially for children under the age of 6. Closing: That wraps up our overview of glycerin. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.